Hello, this is Militia from Everything Adrenal on YouTube. This is part 2 of my newbie information video. If you have not seen part 1, you can go to my YouTube channel, Everything Adrenal, and watch it. Please be easy on me. I've been putting off this video because I'm so worried about, people judging and saying this and that, but I have come to the conclusion that I need to put this out there to help people, because when I was newly diagnosed, there was no one out there to help me. Many doctors nowadays do not know much about Addison's disease. And since I've had to live with it for 13 years myself and matching information to the NADF.US website, I feel like I can help you. So if it wasn't for the support group and all my friends that are out there, then I don't know what I would have done. You will hear terms like the butterfly method coming up that I will explain to you. I did put it in part 1, I think, or I made another video on my YouTube channel about it. So if you want to go to it and watch, that would be amazing. Number 1, the emergency injections. Usually they give you Solu-Cortef, 100 milligram of it's actually hydrocortisone injection. I usually do mine in my thigh. I can close my eyes and do it in my arm if I have to, but my thigh is really good. Dexamethasone 0.4 is equally to Solu-Cortef. It also has an anti-inflammatory in it, so you get a little bonus there. But dexamethasone is a good steroid as well. So for surgery and operations, either they go with dexamethasone sometimes because it has that anti-inflammatory as well in it. But it is as good, if not better, than the Solu-Cortef. The Solu-Cortef is usually the standard. But don't underestimate the dex, because it is longer acting and also fights inflammation. Number 3, flying airplanes. Yay! I've never flown a plane, but high altitudes require stress dosing. The NADF website says on flying, take an extra 20 to 30 hydrocortisone for sudden altitude changes. Some people add 5 milligram, and if they go over 5 hours, they add 5 more. Again, and if it were me, I would use the butterfly method bumping on how I feel. Just keep bumping every 20 minutes, not to go over 100 milligram. That's what I personally would do, but anyway, I think you should listen to the NADF website, 20 to 30. Upon landing, always go by how you feel, and if you feel like you need more, then you need to take it. Some people report they fly and only bump 5 and 10 milligrams. I happen to wonder if it's related to the atmospheric pressure changes and to where they're going, which leads to number 2, altitude sickness. When I was up in the mountains, my doctor advised me against traveling, period. He told me I couldn't go on vacation with my family last year when they went to Colorado, way up in the mountains. I had to stay home because altitude would kill me, because what happens is it really rewires your blood, the way your blood acts, your red blood cells, and it makes your oxygen drop dangerously low to where it could easily kill us. Most normal people, their oxygen drops from 100% to 80%, way up in high altitudes. And for us who already have stress difficulties, our bodies cannot handle high altitudes. I know some Addies have grown up deep in the mountains and high altitudes, and that is very different from us just traveling up there. Their body has had a lifetime to adjust, not like us with the immediate impact of these high altitude changes. Number 3, extreme sports. I looked this up, either depending on mild to moderate stress. If it's mild, I usually just use the butterfly method. And to look at that method, you go to my YouTube channel, Everything Adrenal, for more information on that. If you're doing something really extreme like skydiving, you should probably triple dose. If you're going to do something very, very dangerous, triple to at least completely inject a whole full injection. Something you should call your doctor about, definitely, if you're involved in extreme sports and have Addison's. I would love to hear what extreme sports you do, though. Post those in the comments. Number 4, chest pains. Enlarged heart with Addison's disease can be a sign of an upcoming crisis or prolonged underdosing. Enlarged heart due to underdosing, not enough cortisol. Your adrenals usually make several hormones that regulate heart function, and without these, you can be at risk for cardiac conditions. Keep an eye on your heart rate and your blood pressure, as these both can identify cardiac conditions and go immediately to the ER if you experience any pain. Like I said, I think I talked about heart rate in video 1. You can go back and watch that. Number 6, the butterfly method. This was the method I was talking about. I think I mentioned in video 1. Butterfly bumping, abbreviation for butterfly, is BF. Bump 5 milligram of hydrocortisone, or bumping 5 milligram of hydrocortisone, is my method I use in my daily stressful life. I will take 5 milligram extra of hydrocortisone every 20 minutes till I feel stable of an adrenal crisis symptoms, if I feel them coming on. Number 7, teeth and bone. Steroids can really affect your teeth in a negative way. If you have lost your teeth to steroids, tell me about it in the comments below. Teeth dosing. If you're having just general teeth work done with local anesthesia, you only need to updose 20 milligram. If it's general anesthesia, it's 50. And then an extra 10 to 20 more after the procedure, depending on how you feel. And you also might want to phone your doctor about it as well. But these are the directions on the National Adrenal Disease Foundation website. Number 8, funerals. Mild to moderate stress is 25 to 75 milligram extra, but anytime a loved one dies, the majority of the Addies I know use a whole emergency injection if it's a person close to them, and call their endo for further assistance on dosing. I mean, this can be very, very detrimental and stressful to us. Number 9, hot baths. If you're an Addie with low cortisol, do not go get in the hot bathtub. This will lower your cortisol more and could potentially cause you crisis and harm, since heat increases cardiac output and can put too much stress on you, causing you to feel dizzy and pass out when you stand up. A lot of people don't think about taking hot baths, but you don't want to take a really, really hot bath, or you don't want to take a really, really cold bath. Cold baths can put stress on you just as well. You want to take a warm, lukewarm bath or shower, not too hot or not too cold, just like the 3 bears. Number 10, fever. If you have fever, you need to double with a low fever, double your dose, and then triple if your temperature is over 102.2 or greater. You're supposed to triple. And if your fever continues anyway, you need to go to the ER. Number 11, emotional stress. Low circumstantial, 5 to 10 extra, then go by depending on how you feel every 20 minutes. If I need more, I bump 5 each 20 minutes till I feel stable. 12, dehydration. You need to go to the ER for an IV if you feel dehydrated. This is very, very serious with us Addison's disease patients because of our salt wasting. Number 13, vitamin therapy. Nutrient-rich therapy can offer you so much. It's given me my life back. I used to be bedridden, and now I'm up making videos for my different sites, feeling so much better. Vitamins are very, very crucial to your health in helping you feel better and manage your body pain with Addison's disease and adrenal failure. Many of us have so much body pain, it's unbelievable. People they could not even fathom what we go through with our body pain, with us hurting all over. I have found that a mix of vitamin Bs, all your vitamin Bs, and your aminos by an IV, and then add an extra vitamin D shot in the hip, it usually helps me the best. This seems to be my weekly routine. It had taken away my fibromyalgia body pains I had and restored my body to feeling like it should. These vitamin D shots were amazing. And if you have to take it orally, that's just as well. I mean, number 14, alcohol. Think of it as alcohol as being a parasite, and the steroids is the food. Alcohol eats up all your steroids immediately, so drinking could make an adrenal patient very, very sick quickly and go into a crisis very quickly. Somebody with Addison's disease could end up in a coma just by drinking, so be very careful with that. Number 15, antibiotics. Same way antibiotics love to eat up your steroids. So you always need to double or triple with antibiotics depending on the strength and what your doctor says.